Terrell Friday here with FutureDDS.
Tyler Brown here with FutureDDS.
And today, on this installment of FutureDDS, we have Corey Williams with us, man. He's a graduating fourth year from Tufts University School of Dental Medicine. He's just going to be, we're going to be picking his brain a little bit, talking to him about some advice or just any tips and tricks that we should learn going into fourth year. So, man, Corey, if you could reintroduce yourself, man. Thanks for spending some time with us. Introduce yourself to the people out there.
No problem, Tyler and Terrell. Thank you for having me. Again, my name is Corey Williams. I'm a fourth year graduating senior here at Tufts Dental School, and thank you for having me on.
Nice. So, man, congrats on getting close to finishing up now.
Right.
COVID is kind of messing everything up, but we're gonna celebrate regardless, man. You're a great accomplishment, so definitely clap it up for that, man. We're gonna celebrate when we get back, outside and everything. But so first off, man, I know Tyler has this question as well. Is what do you wish you knew going into fourth year? Now looking back, now that you're on the other end of it.
Well, it'd been great to know that COVID was coming. I think we could all prepared a little bit more accordingly for that.
Sure.
But no, just in genuine, going into fourth year, things that you wish you had known. Just the organization, knowing important dates that are coming up, being aware of what requirements that you have outstanding or remaining, keeping up with step cards and that sort of thing. Essentially knowing the whole goal of fourth year is to graduate, right? So essentially being familiar with what it's going to take to get the smoothest exit from the clinic as possible. And that could be just a matter of, like I say, having your requirements organized so that you're aware of what you're doing, getting the most out of your appointments. That essentially increases not only just how efficient you are in the clinic, but it allows you to be able to go through the treatment plan at a lot faster rate than if you were just candidly, just randomly scheduling appointments and just going about it a haphazard way. Some other things that I think I wish I had known beginning of fourth year. If you are going into a residency or going into the general market, just kind of being aware of what you should be, reading and preparing yourself for those particular things. For instance, if you're going out into the job market, which I'm doing myself, you don't want to start preparing for the interviews 2 and 3 weeks before. It's not the regular interview. Potentially could be the most important interview of your life. So, you want to start early, reviewing some of those practice management seminars as well as some of the lectures, having some great questions, kind of knowing the different ways that doctors are getting paid, the general structure of the contract. What are some red flags and things you should be looking out for? So you want to be training yourself to that when you get in those particular situations, that you're confident and competent enough to be able to handle it and be able to get the most out of the interview.
So Corey, I want to ask you a question, just kind of for the dental students and pre-dents, of course. But so you were probably one of the more confident students when it came to clinic, and I think that a lot of people struggle with that. I've had my times. I'm sure Terrell's had his times. But how can us as dental students, what made you so confident? What made you be able to just say, okay, we're doing this today, let's go, and not have any type of, nervous emotions? Or maybe you did, I don't know. But how did you kind of foster such confidence while in clinic?
It's weird you say it, because in pre-clinic, I was probably the worst student. I had zero confidence. A lot of things at that particular time just didn't make sense to me. I wasn't able to visually see the practicality of it, and things that I can't, understand, it doesn't stick with me. So I guess what built my confidence is just a series of amount of failures, one that I made in pre-clin. But what gave me probably my greatest confidence was just being knowledgeable about what it is I'm doing. For instance, if I'm doing a particular crown prep, I need to know cold hard, what are the actual dimensions of the particular prep. If it's going to be where's the actual lingual cuffs in terms of where's the functional cuffs, where's the non-functional cuffs. It's going to be a PFM crown, this is going to be a gold crown, because all those different types of crowns, depending on the finished material, have different requirements. So being aware of those requirements is just the most important part. Whether or not I'm the best person that can get that particular crown to those requirements, I don't know, right? But the start is, I know I need to reduce a millimeter. I can do that, right? And I think the safety net of having the option or the ability at the school to be able to work under the great professors that we have you essentially know that you know what you can handle and what you can't handle. That's an important skill to be able to learn in clinic. And because we've done so many crown preps throughout our preparation, I'm pretty confident, that I can at least go in and reduce every surface to a millimeter, right? And then in terms of the actual refinement, I can spend more time with the professor if need be. But I think what separates me from the normal person is I know what I suck at and I know what I'm good at. I love pros, but I hated the class. I was horrible at it. It's probably the worst prepper ever. Now I feel like, I can probably I'll prep anyone. And it's not a matter of, oh, I'm so great, but it's a matter of, repetition, getting into the clinic, which is hard to do third, fourth year when you have so much other responsibilities. There's no mandate for you to be in the clinic, but you can set aside time knowing that you got 2 or 3 crowns coming up the following week that you have to prep. You can go in on your typing down and literally prep that exact tooth. Time yourself. Okay, it's going to take me an hour to prep and an hour to make the temp. Try to get that down to 45 minutes each. And I think when you have to do 10 crowns to graduate, if you start with the very first crown like that, preparing for it before it even comes, in pre-plan, getting your reps in, knowing which surfaces you struggle with, kind of having an idea of which surfaces you might need the professor for, then you kind of develop a game plan for that. But if you don't do the reps, it's just kind of like you playing basketball. You got a game on Friday and you're not in the gym Monday through Thursday. You're relying on what you did 2, 3, 6 months ago. Mm-hmm. It's probably not going to turn out that well. So I attack it but the same way. And I think that's the difference of what gives me the confidence. It's not that I'm the best prepper, but it's like I know my limitations and I can only figure that out through the repetition. And that essentially is why I was confident in pretty much going out to anything, because I knew what I couldn't do, and I knew that if I couldn't do it, I could always consult the professor to bring them in for that.
So it sounded like a lot of prep. Just a lot of prep.
Yeah, a lot of prep.
Okay. And so talking about prep, we are about to take our boards part 2.
Yeah.
And it's like right now, I think we're really both starting to really lock in and really focus on that, because I think we're going to take it around like 6 weeks from now, Terrell, somewhere around.
I guess depending on what's all going on with the schedule, but hopefully June, July. July's later.
So around that time. And so we know you took yours, you passed. So what's some tips that you can give us with regards to taking boards part 2?
In terms of the clinical aspect, I think the most important part is to be brutally honest with yourselves in terms of where you stand personally. Mm-hmm. Not that everybody's taking it at this particular time and, I need to take it as well. Unless you just got about $2,500 you want to donate. But other than that, if you know that, you're pretty confident and solid with your endo and your cross skills, then by all means, go ahead, go after it, right? Get it done early.
Hold on. So we're talking about boards. We're not talking about licensing yet.
Oh, so in terms of boards.
So first boards. Yeah, because I think that's what we're gonna do.
I think we got tackle the board first, and I think licensing is
after
August. Later August and May.
Gotcha. Yeah, in terms of boards, so there's a few different things that you can use to prepare for boards. I think in my class, probably the most used things was the Mosby clinical book, which a lot of people use for part 1 as well. And if you look on YouTube, I think that's kind of one of the most sought after books as well. I personally use a book called Denton. I use it for part 1 and I use it for part 2 as well. It's probably by far the best, most comprehensive all-in-one book that I believe that you can find. In fact, if you didn't have a very great foundation going through clinic for whatever reason, or there's things that you might want to read back and touch up on, I think Denton does a great job in putting out the most important material, kind of highlighting and making bold the things that you really should pay attention to. The trouble that I had with Mosby is that it's literally just, an outline, like A through Z through I through double L. Like, I kind of remember information better if I get it in the story form and kind of get the entire picture. I don't need all the excruciating details, but just to go by bullet by bullet by bullet, like that doesn't potentially work for me. And with Denton, you also find a lot of repetition. So like I think going to the local anesthetic and oral surgery section, then getting over to the medical section or the pharmacy section and doing local anesthetics again and kind of seeing like the information that's touched on in both sections, what do they touch on here as opposed to here, what's common and what's not common. That kind of allows you to kind of figure out like the topics that are generally tested, what's pertinent and what's not essential at that particular time. So for me, I stand behind Denton. I really love their book. Again, used for part 1 and part 2, but you can supplement that with questions from the first 1001 book. You can order, like I say, some 88 practice questions, or even get Kaplan practice questions. But if you're looking for just one particular book and some a little bit more comprehensive, I would recommend Denton. If you have a great foundation and you just want to review as quickly as possible, I think Mosley may be a better choice for you. So more so just depends on the individual student.
Got you. So, preparing for that, going into it, we hear so much about, the license exam, the boards exams, all the different qualifications and things we need to do. I guess what was the biggest difference for you? And this isn't necessarily a question for me as well, but for everybody else there watching as well. But what was the main difference for preparing for boards versus preparing for licensure? If you kind of walk us through like the licensure portion, or I guess the portion of going through that, yeah.
I think the hardest part about preparing for licensure is just keeping up with the massive amount of emails. I think that's probably one of the, it's probably underrated. You get so much information regarding boards, and keeping up with that timeline, making sure that you open those days and not potentially, scheduling other things. It could be kind of hard to do. The new corona situation, things could get moved around. It could be even more complicated for you guys. But in terms of the board's timeline, the very first thing you want to do is be aware of when the deadline to apply is, regardless of if you figured out which ones you want to apply for, because there is a $500 late fee that I know of if you're applying for REB and you don't apply by the deadline. So that's the first thing, being aware of the deadline. Once you're aware of the deadline, they usually email you or mail you in the mail a timeline, and that timeline breaks down essentially what you should be sending in terms of radiographs, how to get your patient approved, what are the qualifications for a perio patient, and that sort of thing. And they send you a manual. A lot of people probably don't read the manual. It's essentially your Bible for that particular week. You want to read the manual inside and out. You want to know if you're taking REB, which is the exam that I took, what qualifies an operative patient, what doesn't qualify. Because if you send something in and it doesn't get qualified, then you could potentially lose points on the actual exam. So, those particular things you want to be aware of. And if you're taking, like I say, CDCA, there are different qualifications for operative, between CDCA and REB. REB generally requires it to be through the DEJ as opposed to CDCA. I don't think it goes all the way to the DEJ. Okay. So being aware of the things like that. Also being aware of how many lesions or particular patients you may need. And that's kind of a confusing thing for most people. So it's two things. You need to look at what state you potentially may want to go work in. Mm-hmm. Figure out which exam that state takes, whether it's REB, CDCA, or both. And then look at the specific requirements for that state. Some states may say for operative, you need 2 lesions. Some states may say you only need 1 lesion. Some states may say you need 2 class 2, 1 class 2, class 3. It's different for each state. Texas, the state that I'm eventually going to, is pretty much just 1 class 2 lesion, right? So if you do 1 class 2 lesion in the past, that's all you need to satisfy that. Satisfy that versus other states require you to do a minimum of 2 lesions, or just 2 class 2, or 1 class 2, 1 class 3. So you just want to be aware of that so you can prepare accordingly. If you're not aware of that, and you figure it out on the back end that you need another operative patient, then you have to pay another penalty for that. You see what I'm saying? So like, you register late and you don't submit your operative correctly, or you're not aware of something, have to resubmit operative, you're costing yourself thousands of dollars potentially. So just being aware of that, I think, may be the most important part. Again, every state doesn't require you to take PROS. That's general state thing. So being aware of the state you're going to, surrounding states, and any state potentially you might want to work in the future. Being aware of what they require for operative, as well as PROS, if they require PROS, and everything else is pretty standard. You have to do endo, you have to do the treatment planning portion, but the operative is usually where the confusion comes down to. Is it 1 class 2, 2, or class 2, class 3?
Gotcha. And for the written portion, is it comparable to preparing for the boards? Is it a little bit more, I guess, like regulatory with like state requirements, stuff like that? How is it in comparison?
Yeah, for the written portion of the REB, which is the comprehensive treatment planning, it's really simple, but it's easy to overthink it, right? So essentially, they give you 3 cases. the first case is a simple case. The second case is a little more challenging. And the third case is a pedo patient. And they give you pretty much all the information that you need. They give you the radiographs, the clinical pictures. They give you the probing, the evaluation, social history, medical history. Ultimately, the full detail of the pictures. They also even include like actual intraoral photos for you to be able to see each tube. And ultimately, you have to take all the information and make a satisfying treatment plan with that patient, covering all aspects. And one thing I want to point out is the manual is ultimately what tells you, okay, what's going to qualify for prophylaxis as opposed to a skeletal root planning. And you want to be aware of that. The next thing you want to be aware of is the medications. If the patients are taking medications and let's say some of these medications, side effect is urostomia, then in your treatment plan, you want to make sure that you plan something to address that. They're trying to see if you can look at the patient as a whole and not mostly just, oh, this patient needs a crown, this patient needs a full coverage restoration, or this patient needs RPD. But more so looking past that and saying that should this be treated right now? What conditions could be contributing to the acceleration of decay in this particular patient? And did the student want to address that and prescribe something that could ultimately be used to help treat that particular disease?
Okay. So we're going to switch gears a little bit. So for everybody who doesn't know, at Tufts, we have this thing called externship where we take 5 to 6 weeks and we actually practice dentistry at an off-site location. And so because we have such a large class, everybody kind of has different time periods in which they go. Now, because of COVID, unfortunately, some people's externships have been cut. And I mean, granted, we don't know exactly when we're going to get back in clinic. We don't know if they're going to scratch the entire program at all. But, I know, Corey, you told me how much of an impact your externship site really had on you, especially with advancing you as a clinician. So we wanted to ask you, what would you recommend us do, say in the situation where they actually have to cancel the entire externship program? Like, where can we kind of fill in those gaps as far as getting that experience? Or, I mean, is there not a way? I mean, what would you suggest that we do?
Yeah, Tyler, I think that's a great question. Like I said, I had a pretty good externship experience. I got to do a lot and to see how dentistry is outside of the school. Not from a shadowing perspective, but from being an actual person that's providing the care, I thought was really interesting. A lot of the inherent stops that we have within the school system, you don't face out in traditional private practice. So you're able to move at a much, much, much faster rate. You're able to practice, seeing 2 patients at one time, kind of trying to figure out which patient should be a priority. And then, an emergency patient walks in the door. You don't really get that, especially at that particular rate within the school setting. So from that particular aspect, it's almost irreplaceable because it's nothing you can do in the school that's going to mimic that outside environment. So what can you do to help make that up? Besides, finding time on your own, or possibly if you finish requirements early to go and volunteer or see if you can do an externship just for the experience, not for credit or anything. Maybe the best thing that you can do is just actually trying to still go back and get the experience itself. If I was in that position, kind of looking back now on it, yes, I would feel like I'm at a disadvantage because for some students, that's ultimately the difference of them coming back much, much more confident, being able to do things much, much faster. And just, being in a different setting outside of school, more relaxed. You have assistants, 2 or 3 assistants that'll help you, and you're able to concentrate solely on the dentistry. And there's no environment in school where you get that particular atmosphere that's, mimics the outside world. So me, I probably would try and just concentrate on, things that I can knock out at this particular time. And with COVID, it been unexpected, obviously, for my class. I think it's more of a priority for you guys, to realize that, all the time you think you have, you actually don't have, just trying to knock things out as quickly and as efficiently as possible. And hopefully by doing that, you may have time at the end to go back and still get that experience because it'll definitely get your reps in. You get to do things at a lot faster pace. Even with extractions, things that, very complicated to do within the school. You have these, the oral surgeon residents, they look down your back, or depending on what type of resident you have. In my particular experience, I had a lady, she went to the Army. She was able to show me, very different techniques from what I traditionally learned within school. much faster, much more efficient for the patient. So I don't know, like if you have a great externship experience, it's hard to replace that besides going back and actually getting these experiences. So.
Got you. Okay, so just to, we're gonna start wrapping up here. Don't want to take too much time, but you were speaking earlier about just having the experiences. What was it? You were having experiences of building that confidence and building the efficiency up in the workflow. So I've heard a lot of like hearsay back and forth about people deciding whether they want to go into practice or whether they want to go into trying to do a residency. In order to try to build that experience. So I guess what factors led to you kind of deciding which route you want to go into, or I guess what benefits or cons do you see from each side?
That's a loaded question in the sense that if you ask if you ask most reputable dentists that are practicing now, they'll tell you that every dental student should go and do a GED or one of those particular programs. And for me, I'm a fast learner. Maybe pick things up, extremely fast. Not saying that I shouldn't be the one going back to do one of those programs, but for me, it's essentially training on the job. And if you can get a great mentor, I think that's really the key. If you can get a great mentor that's really going to take the time and invest in you and show you those different things, I think that could be the difference between, a person deciding to go straight into private practice as opposed, to going into one of the continuing programs. Also with me and the amount of loans that I had accumulated up to this point, both between undergrad as well as dental school, that was also another factor in trying to determine, what's my limit? How much more loan do I want to take on? Can I handle that in the future? And that played a vital role into my decision, as well as even specializing. I wanted to specialize in pros, and just kind of looking back at where I were with the loans currently and how much more I would accumulate if I was to go back and do that. I couldn't make that decision from a financial perspective, so I ultimately decided to go into private practice. But for someone else that's out debating that position, I think it really comes down to the particular student, where they are in their dental career, how confident they feel, how much exposure that they've had to doing these various techniques. For instance, if you have to do 10 crowns to graduate and you want to be going into private practice, then I would encourage you to be trying to do 15, 20 crowns. You want to get as much experience under the dental school as you can. If you have to do 2, 3, 4 arches for the dental requirements to graduate, try to do 6, 7 arches. And, by doing so much more, you get to see a lot more. And ultimately, you can prepare yourself as best as you can to be as versatile as you can, so that when you go out, there are things that you can do, knowing that there's still a learning curve, still things you need to learn. It's a forever learning process. But I think that would prepare you if you attack it like that early as you're in clinic, knowing that I want to run my own clinic. What is it going to take? Can I handle the patient's aspect of care from every perspective? And training your mind like that early over 1 or 2 years, I think will give you a greater chance to go out and be successful in the private practice, as opposed to going back to school to potentially get the skills to gain that confidence over the long run.
Got you. Well, I think that's going to wrap it up for today. Tyler, do you have any more questions or anything for Corey while we still have him?
No. I mean, everybody, Corey, actually, we have a system at Tufts. It's called the VIP system. And Corey was my big, and he's basically been Terrell's big as well. So, he's definitely helped us get through all this clinical experience. And so it's going to be rough without him next year, man. But of course, we'll always stay in touch. And it's nothing. And that's another thing about dental school, y'all. You form these relationships, not only professional, but like genuine, like friendships, and keep that in mind, because these people I'm going to be relying on Corey for my career. I mean, vice versa as well, though, and it's building relationships like these. That's so important. And, if you're someone who likes to keep to yourself, whatever it may be, definitely consider trying to make as many friends as possible, because you can learn so much for them, as Terrell and I have from Corey. So thanks again, Corey. We really do appreciate you, bro.
Yeah, appreciate it.
No problem. I appreciate it.
Yeah, everybody out there, that's it for the episode. Thank you guys for tuning in. If you haven't already, make sure you hit that subscribe button, the like button, and notification bell, so you know whenever we post up new content. That's going to be it. See you guys next time.
All right, y'all.